you like your nose? What about you, Ash? Do you like your nose?
I have a little dent here, but, you know, no one's perfect. Yeah.
I think I just need to be, well, men in glass houses need to be a little quiet and careful here with this thing on my face. But if the answer is no, then tonight's guest is exactly the sort of person you'll need to speak to.
Dr. J. Calvert is a cosmetic surgeon from California who is renowned for his primary and revision rhinoplasty. That's nose reshaping and fixing nose jobs that weren't done properly the first time. Jay, thank you so much for coming on the show. It's an absolute pleasure to have you on.
Thank you for having me.
Now, rhinoplasty, I believe that half of Hollywood swears by it. And it's funny because I was just reading up on this, and according to the recent statistics, the number of nose jobs done for cosmetic purposes versus reconstructive, it's not even comparable. In fact, in 2012 alone, there's been a 73% increase in plastic surgery, rhinoplasty being the most popular one. Why is that?
Well, I think the techniques are getting a lot better, and people can reliably get a good nose job now, whereas in the past it was always difficult to know whether you were going to turn out with something that you really liked.
Revision rhinoplasty. I can sort of understand somebody desperate to have a rhinoplasty in the first place if they're not happy with what they've got. But why go back for more? Are you seeing more people trying to go back to what they had originally?
Well, it's interesting. A lot of things bring people in for revision rhinoplasty. The biggest one is the cosmetic problem. They don't like the way it turned out. And so if you're walking around with something that you really don't like looking at, you're going to go back and try and find revision surgery that's going to correct it. But there are a lot of people that have difficulty breathing after rhinoplasty, or there was a really miscue with the fact that they had had some trauma before.
Is that the case with this gentleman here? Because we've got a couple of before and afters. Maybe you can talk us through these.
Well, this is a guy who had some problems with his nose as a teenager. Yeah. He was born sort of with an issue and then wound up having 8 operations. He was outside of the U.S. and he had 8 operations, and I was actually contacted by his government to help him, and they sent him to me, and we were able to build him a nose with some rib cartilage. Okay. And you can see the difference if you have to walk around with the before nose. It's very distracting, and people can't help but look up your nostrils, whereas the after, at least he now has a nose that, you know, makes him presentable, and it's not distracting to him or to whoever's looking at him.
Now, of course, the cosmetic purposes of it is a lot, but let's talk a little bit more about the reconstructive side of it. What are the kinds of problems that rhinoplasty can solve? Well,
if people have had trauma, that's probably the most common reason for people to come to me in general. I do mostly very difficult rhinoplasty, people who've broken their noses or they've had a nose job and then broke their nose, which is a very complex situation because they need grafts. They need the nose to be rebuilt, and so I have to use rib cartilage. I have to use sometimes ear cartilage. Yeah, I make a small incision over the floating ribs here, which are sort of spare ribs, and you get to you get lots of cartilage to rebuild the nose. And I do that very commonly in my practice. With somebody who's never had rhinoplasty, that's very unusual to do that. I think I've had to do that one time where they had some very strange issue.
Jay, how much of, what's the percentage of your job is? Obviously, you're a surgeon, first and foremost, but how much are you a counsellor as well, with people coming through the door in this day and age with there's so much choice available to people, and you just are put in front of people and they say, I want this kind of nose, doc, and you go, that's just not going to work. Is there that element as well? There
is. I mean, there's no question that patients have to have reasonable expectations. Yeah. What I tell them is I can make them a better version of their nose. And I don't bring that out first. I first listen to them and let them say what it is they're looking for. They come in and say, I want to, you know, get rid of the bump. I'd like my tip to be a little bit higher, it drops down, and I'd like the nose to be narrower or straighter. Then I say, well, those sound very reasonable, examine them, and then I say, yes, that's possible. But if they say, you know, I've had people come in that are, you know, have super wide noses with thick skin, and then they bring pictures of, you know, Megan Fox and say, I want this. I said, well, you know, that's probably not happening today. You know, and it's, you just have to be very clear about what you can achieve with what they are
Yes.
there with in the first place.
Yeah.
Now, I mean, of course, people these days are becoming increasingly more aware, and their knowledge about cosmetic surgery is very sophisticated these days because of the obvious increase in online research. But from a doctor's point of view, what is the kind of preparation that one needs to go through before undergoing a nose job?
I think it's really doing your homework on who's operating on you, and that usually means that the internet is somewhat helpful, but there's a lot of problems on the internet. You know, anybody can write anything they want anytime, and you can't take all the information at face value. There are a lot of blogs and these forum sites where the information is just flat out wrong. And I read these things on these forums, and people will bring them in printed to me. Now, is it true that I can go skiing after 5 days with my splint on? And the answer is no, you cannot. So it's really difficult to use online information, but there are resources like plasticsurgery.org. There are some authority websites that are put out by plastic surgeons, and usually the websites of the surgeons themselves have the information you need.
Based in California, performed surgery in Beverly Hills, Newport Beach, over here with the Aesthetica Clinic in Dubai, Healthcare City. Why Dubai, and what can patients expect during your visit here?
Well, the reason we came to Dubai is I have a lot of patients from the Middle East. They come to Beverly Hills and they said, boy, it sure would be great if you made your way to Dubai. And I think this is one of the most exciting cities in the world.
Taxi ride, isn't it? I suppose.
It is. And yeah, they spend more money being in Beverly Hills and living there for 2 weeks or 10 days than they do on my operation.
Right. Okay.
You know, I kind of wish I was the Peninsula Hotel. But the reality is that I came here because I have a lot of patients here, and I think that there's a need, and you know, nobody likes to do secondary rhinoplasty. A lot of the plastic surgeons that I've spoken to in town here just said, boy, you know, you can have them. These are really hard cases and nobody wants it. So I think that there's a niche that I can help fill. And my clinic, the Rock Center in Beverly Hills, we really want to reach out to this part of the world, and Dubai is just an incredible place to be.
Yeah, and if you can't get a meeting with Jay this time, he will be back, that's for sure. He's assured us of that. Aesthetica Clinic in Dubai, Healthcare City. All the details are up on our Facebook page now, facebook.com/Studio One Live. Jay, thank you so much indeed for being with us. And thanks
thank you.
For Studio One.
Yeah, this was great. Thanks, Simbad.
After the break, Ilham checks out the mixed martial arts scene in Dubai.
Yeah, looking forward to this one. Don't go anywhere.